the side as well. So now we're going to drop down into that flexion and just swing the legs nice and easy both directions. Hey guys, Dr. Mike here, Oak Brook Medical Group in Oak Brook, Illinois, and I'm here with one of our patients, Mr. Juan. So let's talk about it. Juan came in originally for low back pain and the sciatica type pain, right? Everyone talks about sciatica. Well, what is it? So you have nerves that come out of the low back, especially in those lumbars, L3 down in S1. 4 big nerves that come down and they make one big fat nerve called the sciatic nerve that runs all the way down the leg into the toes. So when we have sciatica type pain, what we're dealing with is some type of compression of that nerve, whether it's coming from the low back, the piriformis, it can be entrapped in the hamstrings. There's lots of different ways it can cause that. Mr. Juan's was coming from that low back, right? So, been treating him for a while now. Went through, did amazing with his rehab, his exercises. So actually, speaking of following up on this video, I'm going to do another one showing you guys 3 of the best exercises you can do at home to help prevent you from getting the sciatic and low back pain. All right, so he did amazing with that. Followed up with the nurse practitioner, and today we're going to walk through his adjustments and show you exactly what we did to help open up that low back, open up those disc spaces, and get that pain to relax for him. Ready?
Right.
Let's do it, sir. Face down, please. So one of the first things, and come down just a little bit for me there, Juan. Perfect. One of the first things we did, which we just love, our patients love it, we love doing it to them here, is the flexion distraction. So, like I mentioned, with that sciatica type pain, it always starts right here in that low back area, all those nerves coming out, running down the legs. So flexion distraction, what we're going to do is start to open up those disc spaces. So we're going to extend that table out, starting to stretch them. And then what we're going to do is I place my hand here in the small of the back. We're going to block those vertebrae and then drop down into a flexion and just start pumping those discs. So again, we want to open up the disc space. By opening up that, we can take pressure off of the nerves, get things starting to move properly. Just give it more space. All right, so we start down there, L5, and just start to work our way up. And I would say 99.9% of the time, patients tell us that this just feels like the greatest low back stretch they've ever had. So if nothing else, it's feeling good, it's relaxing those muscles, getting some motion in there as well too. And not only do we do just dropping down, but then we'll do a little bit of side to side as well. So now we're going to drop down into that flexion and just swing the legs nice and easy both directions. Again, opening up both sides, getting a little bit of a deeper stretch into that lumbar spine. Perfect. One more time through there. Good. All right, bring that in. So, loosen things up a little bit, get some motion through there into those discs. Now we're going to get them stretched or adjusted here. So again, lots of different ways we can adjust. With one, we do the drops. So we're always checking to see. Obviously, we want to bring up that right hip. Good. And easy into that L5, drop there. Beautiful. On your back, sir. So then when it is low back pain, we're still always going to adjust that mid back as well, right? Because those muscles that get really tight protecting you run all the way up into that thoracic spine. So here we're going to bring it up. Oh, good ones today. One more. Beautiful. And then nice and easy. One's trying to get a little bit taller, so we're just pulling on those hips, opening up the hip joints. Good. A little motion in that ankle as well. Come on up, sir. All right, so that's how we've been treating his sciatica pain. Like I said, doing way better, pain-free at this point. Now we're just working on really strengthening things and keeping that way for the long term for him. So if you're dealing with the sciatic pain or low back pain, or know anybody that's dealing with it, give us a call at the number below. If you're watching on YouTube, hit that notification bell, like, follow the page, Facebook, Instagram, like and follow, and we'll catch you guys in the next video.